Good afternoon. My name is Magdalene Rogers. I'm the Executive Director with the Neurological Alliance of Ireland, and welcome everyone to the CHO4 launch of Patients Deserve Better, which is a nationwide campaign led by the Neurological Alliance of Ireland in collaboration with 22 neurological charities, and you can see their logos on the screen there. The campaign is in collaboration with Roche Products Ireland, and as I say, in collaboration with 22 of our member organisations. This campaign is calling for a community neurorehabilitation team to be established in each of the 9 community health organisations around the country. To date, only 2 of these community neurorehabilitation teams are up and running. CHO4 is still waiting for its team, which was promised as far back ago as 2019 in the publication of a national framework. So this afternoon at our webinar, you're going to hear from local clinicians, patients and family members from the Cork and Kerry region, and they'll talk about just how important these teams are for people living with neurological conditions. I just want to give a reminder that this session is recorded, and the recording will be available afterwards for people who were unable to tune in today. But before I hand over to my speakers, I just want to welcome our audience. In particular, I want to welcome the elected representatives who have joined us today. I want to encourage them to use the chat, because this is a webinar and we can see everybody, just to use the chat function to let people know that they are here, just to introduce themselves and let people know who is on the call today. And I'd also encourage them to use chat to ask any questions, any of the participants today to use chat to ask any questions, and I'll do my best to bring those to the speakers today as well. Before I hand over to my first speaker, I just want to just quickly do 2 slides. So Zorka, if I can just go to the next slide there. Just around the community neurorehabilitation teams, you'll hear a lot of messages today around people's experience in living with neurological conditions and the services, the neurorehabilitation services that are available in CHO4. But just briefly to talk about community neurorehabilitation teams, these are relatively small teams of key therapists like physiotherapy, speech and language therapy, occupational therapy, neuropsychology, and they provide critical care in the community with people with neurological conditions. It's estimated that and these are HSE's own figures from the implementation framework that was published in 2019, providing these 9 community neurorehabilitation teams nationwide would save up to 42,000 hospital bed days each year. And you will all remember that from the earliest days of this year, all we were hearing about was the lack of hospital beds and the A&E crisis. So we hear so much about caring for people in the community and sláinte care, and these teams really are sláinte care in action. These are providing care in the community where it's needed, keeping people out of hospital, keeping people well in the community, and both of our clinicians will go into detail about that when they speak. And just the next slide there, Zorka, just briefly. Just again, the cost saving of this, for every euro spent on community neurorehabilitation teams, the health service saves 11 euros. And again, that is because these teams get people out of hospital quicker. So discharging people with neurological conditions, and also that they keep people out of hospital, keep people well with neurological conditions in the community. So at this point, I'm going to hand over to the first of our 5 speakers at the webinar today. I'm going to hand over to Professor Aisling Ryan. She's a consultant neurologist in Cork University Hospital. And she's going to talk about the neurological patients that she sees and how important access to community neurorehabilitation services and the community team is to those patients. So if I can hand over to you now, Professor Ryan.
Thanks very much, Mags, and welcome to everybody who has dialed in and is listening. As Mags has said, I'm a consultant neurologist at Cork University Hospital, and I am here since 2006. And just for context, CUH is a national neuroscience centre. It's one of only 2 neuroscience centres in the country, the other one being Beaumont Hospital. And we are on call 24/7 for neurological emergencies. And as such, we see the largest number of neurological cases and complex cases, and we get referrals from across the region, including Tralee, Bantry, Mallow, and further afield. And we also look after a really large outpatient population with chronic neurological illnesses. And CUH is the major trauma centre for the South Trauma Network, and that includes neurosurgical trauma and brain injury. So overall, it means we're seeing a huge range of neurological conditions which require community neurorehabilitation. And just to understand, I suppose, a bit more, what are these conditions that we're seeing, and what conditions do patients have? In CUH, I coordinate and run a multidisciplinary clinic for motor neuron disease, which has been running since 2007. We have a multiple sclerosis clinic, a dedicated neuromuscular clinic for patients with complex neuromuscular conditions, post-polio patients, muscular dystrophy. And we run other clinics where I see patients with conditions like Parkinson's disease, Huntington's disease, traumatic brain injury patients, brain tumor patients, and each of these patients has a requirement for community neurorehabilitation. And as we've heard, only 2 community neurorehabilitation teams in Ireland are in place, despite a requirement for 9. And that means only 15% of neurological patients currently have access to that level of care to support their recovery and to optimize their rehabilitation. Or to put it another way, 85% of patients do not. And what exactly is a neuro rehab team, and what does that look like? Mags has touched on it there, but essentially it's a team of healthcare professionals with different skill sets who work together to support patients' recovery and to prevent future disability for patients with neurological conditions. And typically the team would include a speech therapist, because many patients with neurological conditions lose the ability to speak or have difficulties with articulation or swallowing difficulties. The team would include a physiotherapist, typically. A physiotherapist is really important in helping patients optimize their mobility and promote recovery of function if there's been a weakness, if they've had a stroke, or if they have something like a foot drop. An occupational therapist is another integral member of the team, and an occupational therapist helps with patients' day-to-day needs. For example, if patients need a specialized lift, a type of wheelchair, other day-to-day activities such as feeding or dressing themselves, the occupational therapist can be very helpful to allow patients to do these things by themselves with the right aids. And the team also includes a dietitian, and many of my patients would have a feeding tube inserted for various reasons, and we need a specialized dietitian to understand their caloric needs and to optimize their nutritional intake. And another member of the team is a clinical neuropsychologist, and a neuropsychologist really is an integral member of the team, and they are important for assessing patients' neuropsychological abilities, their memory, their learning abilities, but also for providing support to patients to cope with their disabilities. And together with the neurologist, we all work together with these experts to aid patients to kind of optimize their care. The real problem at the moment is we lack a clearly defined pathway for patients to access community neurorehabilitation when they leave hospital. And in many cases, it may fall to already overburdened and busy general practitioners to refer patients to community services. So instead of a seamless transition of care from hospital to community, patients might go on a waiting list where they wait to be seen by the community therapists at a time when their neurorehabilitation needs are most critical. And so what are the benefits of investing in community neurorehabilitation? We have heard already the huge saving in bed days that providing these teams would give, up to 42,000 bed days nationally each year if these teams were in place. Now, as somebody who deals with bed shortages on a daily basis, this would be an incredible saving for the health service and for patients who need access into hospital. Providing these community teams would allow patients to continue their recovery at home, and it would be closer to where they live. This would reduce travel time for patients, ease the burden on carers, and improve quality of life for all. And another particular aspect I think about when I think about community neurorehabilitation is how it helps, particularly with things like mobility and preventing falls. And if you have a neurological disability and you're working to recover, a fall, which can lead to a fractured hip, can have so many adverse consequences and set patients back so far. But if you can provide that early intervention from the physiotherapist or occupational therapist, maybe a splint for their foot drop, or the correct walking aid, or optimize patients' mobility, then you can avoid the negative consequences of falls and you can prevent long-term immobility. And we can also, by optimizing recovery and by preventing progression of disability, we allow patients to remain active in their employment and to progress their careers for longer and to remain active and engaged members of the community as they want to be. And I can give you a real world example of the issues we struggle with. I currently have an inpatient with a complex condition who's been attending me for 10 years and has recently had a feeding tube inserted here in hospital because he can no longer swallow due to his condition. He's lost a huge amount of weight. He's lost a lot of function in his hands. So his day-to-day activities, such as shaving or brushing his teeth, are difficult, and he requires input from our occupational therapist. He can just about walk with the assistance of a frame, but he's a really high falls risk. He's ready to leave hospital, but he can't just yet because we need the input from all our specialized therapists to help him to optimize his care and from the dietitian to optimize his nutritional requirements, given he's got a feeding tube in place now. If we had access to a dedicated community rehabilitation facility with all of these specialists, this would allow him to get home sooner, where he would be more comfortable. And also his ongoing care in the community would give his family more confidence on how to manage his care needs for the future. And I think I'd also like to highlight the fact that the face of neurological disease is changing. Patients with neurological illnesses are living longer due to advances in therapeutics and new medicines that are coming through. And we're seeing this in conditions like multiple sclerosis. We're seeing it in some genetic neuropathies like amyloid neuropathy. We see it with spinal muscular atrophy in children and in adults, and other rare neurogenetic and other acquired neurological disorders. And of course, this is very welcome, but we need to ensure that the quality of life matches the longevity. And to maximize that quality of life, we do depend on the provision of the community multidisciplinary neurorehabilitation team. This is not an optional extra in the care of neurological patients. It's a really integral part of their treatment and management for complex neurological conditions, just as much as their pharmacological therapy in many cases. And we're doing our patients a disservice by not providing that holistic care from hospital to community. And finally, I'd like to thank you again very much for giving me the opportunity to speak to you all today, and for the support of the Neurological Alliance of Ireland and for all the patient support groups who really help and support our patients. So thank you very much for your attention.
Thank you so much, Professor Ryan. I think you've eloquently described how important a community neurorehabilitation team would be practically to enable you to do your job. You know, and as you say, to ensure that these people are not sitting in hospital, that they're in the community where they belong. And it's a critical part of your own service to have access to a community neurorehabilitation team. And just to say, before I pass on to Dr. McFarlane, it really is a postcode lottery in terms of access to neurorehabilitation. We heard at one of the launches for this campaign how a rehabilitation consultant can just look at the address when, you know, in the National Rehabilitation Hospital and know just from looking at a patient's address around the country what sort of neurorehabilitation they would have access to. So Professor Ryan, thank you. And I'm going to go on to our next speaker, who is Dr. John McFarlane. He's a consultant in rehabilitation medicine from Mercy University Hospital, and he's just going to talk about the access to neurorehabilitation services, in particular community neurorehabilitation services in Cork and Kerry. I think you're on mute there, Dr. McFarlane, if you want to come in. Yeah.
I was on mute there. Thank you, Magda, and Professor Ryan has covered a lot of the areas I was going to talk in as well, so I won't repeat myself. but I also emphasize the number of reports that have been done over the years recommending these services being rolled out. The National Strategy and Policy for Provision of Neurorehabilitation Services was published in 2012, and then there was an implementation plan from theory to action in 2019 to 2021. We still have awaiting the rolling out of services in the community. The National Clinical Programme for Rehabilitation Medicine produced a model of care document in 2019, and that emphasised the importance of patients being linked into managed clinical networks in a hub and spoke model. So the National Rehabilitation Hospital in Dún Laoghaire will be the tertiary referral centre, in other words, catering for those with very highly complex needs with conditions of a high level of disability, and it would be served then underneath them regional rehabilitation centres, and then the importance of specialist community neurorehabilitation teams in each locality. Unfortunately, we've made very little progress in the last number of years. We don't have a regional rehabilitation centre in the south. We're still awaiting provision of specialist community neurorehabilitation teams. Dr. Ryan has given very good examples of what this means for patients, both in terms of accessing hospital services and also living in the community as long as possible and preventing having to be admitted to hospital. What I would say is that I guess many patients, reporting back to me that they got great care in the hospital, but that transition going from hospital to home can be very fraught with, new disability, having to cope with that themselves. And that was what the one plea that patients had, is they had more support on being discharged home from the hospital setting. I think that was about as much as I wanted to say, apart from, again, thanking all the organisations that are involved with the Neurological Alliance of Ireland. They do great work, and as I say, supporting the patients is such an important role, given the shortage of statutory services that are there at the moment on the ground. Thank you.
Thank you, Dr. McFarland. And I suppose just to say as well, just put it in context, Cork, with the hospitals in Cork, it is a major centre. It's the second national neuroscience centre. It's a designated major trauma centre. And so, it really is, unacceptable that there would be such a dearth of neurorehabilitation services for the region, given that its importance as a hub for the treatment of neurological conditions.
Exactly. Yeah. Well said.
And, in terms of your own situation as a consultant in rehabilitation medicine, I presume that you echo what Professor Ryan was saying about just the lack of current pathways of being able to discharge someone to the community with a neurological condition.
Oh, yes. I mean, there's a huge gap in services there, both in terms of having a regional rehabilitation centre rather than waiting for the National Rehabilitation Hospital to get involved. Because of the demand on their services from across the country, the waiting time now is up to 6 months for people to access, specialist rehabilitation services. And we need to develop services in the region to have a regional rehabilitation centre. And not alone that, it's likely that that service could get, clogged up, with difficulty with discharges, unless we have a good working community rehabilitation teams be able to carry on the rehabilitation in the patient's own home. Because let's not forget, never mind sláinte care, which advocates delivering care as much as possible near the patient's home. The home is the best environment. It's the most realistic environment that patients have, rather than an acute or even a rehabilitation centre. We need to get patients back home and rehabilitating there as much as possible.
Absolutely. Thank you, Dr. McFarland. And I suppose just to make that clear, that while the campaign that we're carrying out at the moment is for a community neurorehabilitation team, there are needs all across the provision of neurorehabilitation services in CHO4. And just to convey that message to the elected representatives on the call today, that as they were focusing particularly today on community neurorehabilitation teams, but there is a dearth of neurorehabilitation services in CHO4, and the neurological services, I suppose, they don't have, as Professor Ryan, as yourself, Dr. Farrell, have commented, they don't have that pathway, they don't have those services to discharge people onto, as you say, where they belong in their own homes, to have access to that care. So thank you very much for giving that overview and that local overview. And I think it's particularly interesting, a little bit depressing to look back on all the different reports that have been published and how we really haven't seen action on them, and particularly in the south of the country. It certainly is a black spot in terms of access to neurorehabilitation services. I want to bring in Dennis here, Dennis Fitzgerald. He's a patient in Cork living with motor neuron disease. Dennis, if you want to just come in and talk about your own experience of living with motor neuron disease and your access to services. I know that you're trying to get physiotherapy, or you're relying on a charity to provide some of your physiotherapy. Just come in there.
Okay. Dennis Fitzgerald is my name. No, I have a speech problem. So if you can bear with me, please, while I talk through this. I live in Summercove, Kinsale, in County Cork. Now, I was diagnosed with motor neuron in December 2005, but I had symptoms a year and a half before being diagnosed. The first neurologist that diagnosed me gave me no hope and told me that I would be dead within 3 years. He was insistent that I think about the end of my life decision very soon and not to leave it too long. So Helen, my wonderful partner, would not accept this. So she went looking and found Dr. Ashley Ryan in 2006. Now, Dr. Ashley gave us great hope, and she said, I cannot cure your MD, but we can manage it with the help of my multidisciplinary team at the COH. Now, my confidence was shattered at this point in time by what the previous neurologist had told me, but I quickly grew as Dr. Ashley introduced me to a physiotherapist and a speech and language therapist. So they worked with me to tell me to regain my strength and confidence. At that time in 2006, my voice was so weak, but the speech and language therapist worked with me tirelessly. So I eventually gained the confidence and strength to speak again. I suppose I cannot stress enough the importance of the physiotherapist and speech and language therapist for people with MND. I know for sure that without regular physiotherapy, I would not be as mobile and healthy as I am today, 18 plus years later. My physiotherapist has given me a much better quality of life, which has allowed me to stay independent for longer and has greatly improved my mental health and well-being, allowing me to feel stronger both physically and mentally. Personally, physiotherapy has been greatly with joint stiffness and maintains joint mobility for longer. It reduces muscle aches and pains, and it certainly improves circulation. My physiotherapist is constantly offering me guidance on how to prevent trips and falls and how to get up and sit down safely. He advises me on posture and positioning, tell my breathing and improve comfort. And also he he advised me on techniques on how to get in and out of bed, which might have sound very a simple task, but I can assure you, for me personally, it's a huge task, and sometimes I have to call my partner Helen for help, but by and large, all down to my physiotherapist, I can manage on my own 99% of the time. But I really had to fight for physiotherapy. At the HSE would only allow me 6 physiotherapy sessions at a time. Then they would discharge me, and I had to wait months to go back into the system locally. I suppose I'm speaking here about the local Kinsale community service center. They have a state-of-the-art gym in Kinsale, which is underutilized, I must say, from personal experience. I was using a motorment in the local HSE community care center, and I found it very beneficial because I could exercise my arms and my legs as like cycling. But this was, I found it very beneficial when my time on it was very restricted. And I asked, could I get one at home for home, because I felt I would use it nearly daily. But I was told I would be put on a list of a pool of people, and that I must be given the loan of one boatman at home for 2 weeks a year, which really was of no use to me. I attended a neurophysiotherapist privately at this time, and she told me she strongly advised me to try and get one for myself at home. So I had myself went about sourcing a second-hand one, and lo and behold, we got one up in County Mayo. So I can tell you I've been using that on a daily basis since I got it, and I found it excellent. I haven't maintained much strength and mobility. I suppose, I really feel totally let down by the HSE when my ongoing needs and requirements for physiotherapy as a person with MD. Only for the Ironman Day, I can't speak highly enough about this wonderful charity organization. I would be lost. They are now funding a physiotherapist who calls to me once a week at home, which is just fantastic service. And this man can anticipate different issues with my muscles, my legs, my arms, my breathing. I use a BiPAP breathing machine at night because my lung muscles are impacted by the MD, and this man has great knowledge of neurophysiotherapy. So really, I think the MD depend on fundraising that will fund costs of providing these excellent services and care to MD patients. I really feel the HSE should be providing physiotherapy, speech and language therapy for neuro patients in the community. Like I said, before the local concerned community service centre owned by the HSE is a state-of-the-art building, but unfortunately they're understaffed and they've two full-size gym there now with a lot of equipment. So it's a shame the people who need the access to these services cannot. So thank you for listening to me, and I appreciate it. And again, I would like to strongly thank the IMND for all the help and support they give to me, and not only me, but all of their IMND patients around the country over the last 18 years for me personally. Thank you.
Thank you so much, Dennis. And you know, I've spoken to you outside of this webinar, and you're a fantastic, you know, motivator for your own care. You've done so much to, you know, to keep exercising, to keep, you know, to keep in charge of your own care as much as possible. You know, you're certainly a great champion for the work of the Motor Neuron Disease Association. And that's something that we see up and down the country, that because of the lack of these community neurorehabilitation teams, a lot of the times charities are having to step in and provide support and pay privately in some cases for access to services like physiotherapy. And it really isn't a sustainable funding model for those organisations and for the patients themselves. And Dennis has spoken about that experience of getting small bursts of physiotherapy, like 6 sessions, and then there's a lag and he's trying to get that service again. So, you know, the importance of that consistent access to those therapies like physiotherapy for neurological patients, that they can't be experiencing those kind of breaks and gaps in their care. And that's where a community neurorehabilitation team would be so important in having that consistent interdisciplinary approach. So thank you, Dennis, so much for talking about your own experience. I'm going to move on to Mary. Mary's had the experience of working in an interdisciplinary team and seeing what they do. So she brings that unique perspective. But Mary, I'll let you tell your own story if you want to come in there and just talk about your experience and you know, your recognition of the need for that multidisciplinary team in CHO4 for people with neurological conditions.
Hello, everybody, and particular hello to all our audience who are listening to us. My name is Mary, and I live with my beloved Brian, who has Huntington's disease, and he has also survived 2 strokes. We're married 47 years, and we have a number of adult children as well as 6 gorgeous grandchildren. Huntington's disease is quite a rare, complex neurodegenerative disease. It's actually caused by a faulty gene that affects the brain and nervous system. It can cause significant changes in a person's movement, in their mood, in learning, in thinking, and in their emotions. Unfortunately, it is also hereditary, so that it affects families over generations, and it leads to a progressive deterioration of all areas in the affected individual. Most people get it between 35 and 50 years of age. Some people get it earlier, and then people like Brian get it, and it's called later onset Huntington's over 60 years of age. So Brian showed signs really, I suppose, for the past 15 to 20 years, but he's been diagnosed 15 years now. And so he got it when he was around 60. Before that, he had also had a stroke, and he has had a subsequent stroke since as well. Unusually for us, there was no history of Huntington's disease, and it was confused with the stroke, the fallout from the stroke. But then his first cousin was diagnosed in the UK, and that's the first thing we heard about it. And nobody that we know in the family was diagnosed before. There are a lot of issues associated with Huntington's disease. The swallowing is quite a big one. At one stage, Brian went through a phase of choking, which was actually very, very frightening. And it happened on a number of different occasions, but we were lucky to be referred to the speech and language therapist. And it's very important that Brian isn't frightened of eating, because he loses weight very quickly due to the involuntary movements. Some people might have known it as chorea. And so it's important that he's not afraid to eat so as to maintain his weight. He needs extra calories, 4,000 to 5,000 a day, which is no mean feat. So he's usually enjoys his food very much, and that was very important for us. But the speech and language therapist was invaluable in giving a lot of help with the, assessing what was wrong, and then giving very relevant help in the whole area of food and eating, posture, everything that was associated with it. And so the biggest fear really is that it would lead to aspiration of food and pneumonia, and that's the last thing that we would want for him. Another issue is a lot of clumsiness and involuntary movements associated with with Huntington's disease, and so we were terrified really that he would fall and, as Dr. Ryan said, break a hip or all the other things that could happen, fractures, whatever. So that we were, because of having had the stroke, we were actually involved with different multidisciplinary people in the community at the time. So that he did one very good course, which was learning about falls. So personally, I think everybody who has Huntington's should be in a position to get that, to do that course and learn. And as Dennis said, learn how to get up properly or how to protect yourself and all that as well. So the physiotherapists were fantastic. In addition, because of the movements, the involuntary movements, the related stigma associated with that, can appear as if a person is drunk or on drugs, which has often been mentioned. And this can lead to feeling very isolated, really, I suppose, and sometimes maybe with some people with Huntington's being afraid to, or being unwilling to participate in family gatherings or social occasions, which is a shame, really. Now, thank God Brian is okay with that. But the occupational therapist was a big help to us as well, and the physio, and providing aids and all the various equipment and specialized seating and different things for to enable him to live, I suppose, a better quality of life, really. Then the dietitian as well has been a big help to us, but unfortunately, appointments for all the disciplines really are, as other people have said, there's long waiting lists. You're waiting, you get a certain amount of appointments, then you have to wait again, and time goes by, and there's at a critical time, particularly when a person is diagnosed or early on, the big thing I suppose that would be necessary would be for people to get input early so as to avoid all the problems down the line. So we'd be very, very strong in advocating for that. Unfortunately, another feature of Huntington's is quite a strong, for some people, and Brian did experience, was paranoia. So he did go through a period of paranoia, which was very distressing for us as a family. As his personality changed, he thought everything was fine himself, but I was at the receiving end of feeling everything was at fault and all of that. And that went on for a while because he was unwilling to see or to engage with any professionals. And he certainly was adamant for a year and a half, I suppose, really, that he wasn't taking any medication. Thanks be to God, in the end, he was referred to a neuropsychiatrist who was able to persuade him to take the appropriate medication. And that changed our lives again and brought him back to the lovely Brian that I had known for the past 50 years. But for other people, it's not as easy as that. They actually have quite severe psychiatric problems and need the appropriate service for that as well. One of the features as well is that a person with Huntington's, and this was the way with Brian, would think that they're fine, and they would be reluctant to actually engage with some of the the local multidisciplinary team or the local, and if somebody was specially trained and all of that, they say that regarding Huntington's disease, that some healthcare professionals may only see one or two in their whole career, so that we really need people in the unusual rare illnesses to have access to people who are specialized and who are specifically trained in the neuro rehab of people with the neurological illnesses. And I can't really second that strongly enough with what Dr. Ryan in particular, how she outlines that whole area. I suppose for us, it's very difficult to advocate for somebody who doesn't want services, and you really need people who are specialized in that whole area. We were at one stage very blessed in being able to have access to neuropsychology in Beaumont Hospital, and that was a great help to Brian and also to the family. I would second very strongly the need for neuropsychology being an integral part of the multidisciplinary or interdisciplinary team, because it's when people are able to talk to each other, really, the neuropsychologist can get input from the speech and language therapist and all of that. I worked in early intervention for children with learning disabilities myself, and we had child and family centres, and we did, the child was and the family were the centre, and we had an interdisciplinary team, and it was wonderful, when everybody was able to talk to each other and discuss what's going on with the family and give appropriate help then. We also had to get private neuropsychology ourselves, and really that should be available locally. There's so much more I could say. I really reiterate everything that has been Dennis and Dr. McFarland and Professor Ryan have said about the need really to have specific local neuropsychology, rehabilitation teams. As I've explained already, we need a consistent, clear pathway. You go from pillar to post, the right hand doesn't know what the left hand is doing. You're seeing so many different disciplines, and really if everything was, if people were able to work together, it would be a huge help for us as a family. Brian really is a central part of our family, and we really want to keep him at home as long as we possibly can. And because of it being hereditary, there's a danger that some other members of our family may present with it as well. And we really want to know that they're appropriate and the appropriate services are available for them if and when they may need them. I just want to thank the Huntington's Association in particular for all the help they gave us, and also MAGS and NAI for the tremendous work that they're doing. And the Cork Stroke Support Group has been very, very helpful to Brian and myself as well. And as we continue on our journey, we're unusual insofar as Brian is 75 now. And thank God he's still with us and still able to participate in life and enjoy it. So thank you very much.
Thank you so much, Mary, and thank you for giving your story today. And just I suppose, you've given a really strong testimony to the importance of that pathway, as you say, of just shopping around for services. And I'm thinking when you were saying about neuropsychology in Beaumont Hospital's a long way from Cork.
Yeah.
If you're trying, if that's where your service is based, and just that need, what we're hearing throughout the webinar today of the need for those services to be available locally. I'm going to go now, thank you, Mary, and I'm going to go to our last speaker, Ivan O'Regan. Ivan, again, a Cork native, and he's going to speak about his experience of living with Parkinson's disease, and his partner Eleanor might come in there as well, just, around their challenge in accessing those services, the difference the community neurorehabilitation team would make to them. If you want to come in there, Ivan.
Thanks, Mags. My name is Ivan O'Regan, and I was diagnosed when I was 31 years of age with Parkinson's, and I'm delighted to be able to represent the Cork and Kerry community of people living with Parkinson's. So I suppose I just want to talk to you about, show you here is my timeline, which can you see that you can? So yeah. I just have a PowerPoint, the timeline of my diagnosis, because I think it's very important to see where I have areas here where there should have been intervention, basically. So in 2011, I was diagnosed with Parkinson's. And in between that and 2017, Effie was born. And between that, then early intervention is key for someone like myself. So many years later, it was probably a couple of years later before I found out stuff like Parkinson's medicine, that you should be able to, take it at a certain time, you must take it with a full glass of water, all this sort of stuff. These are simple stuff that I should have known, but it took many years to find stuff like that. So public health nurse, it was through the public health nurse that I got in contact with an occupational therapist after Effie was born. So that's how, that's another reason why an occupational health nurse was, they put a bar, basically, I wasn't able to get out of the bed. So Eleanor used to push me out of the bed to get out of the bed. So simple stuff, I got a bar and decided to bed and I was able to pull myself out. And then later on, I suppose there was there's mental health, apathy. I had no motivation. I got rejected for judo pump, and I got rejected for UK. I was going over to DBS, so I ended up inside the hospital in Dublin for a couple of weeks, 3 weeks, and basically, it couldn't have gone any worse really. And between, because the hospital didn't know how to handle me, a person with Parkinson's, and so between my own family and my GP, it ended up that I got a little bit better. And then it's actually this day last year was the day that I had DBS surgery, so I had deep brain stimulation surgery, and that basically has changed my life. But that is something that not everyone can access or can get. So and since then I've had 2 major assessments. I've had basic I have had speech and language therapist and a physiotherapist. I've had 2 assessments in the last year because I've had DBS, but I'm a person that has access to DBS. I've had access to DBS, so I'm able to get access to that. But there are people that are living at home on their own, and they don't have any of this. I suppose, clinical psychologist is a necessity as well.
So I suppose on Ivan's timeline, where he has hospital in Dublin, that was for his mental health, and we had to seek that out. I had to, I guess, push for him to go and see someone first of all, like his GP, and this was a private appointment. It was private care, and like he said, they didn't know how to handle his physical condition and his medication needs for Parkinson's. So while he did get some benefit from that private mental health facility, it wasn't the most it should have been. Also, he was away from his family in Dublin because he had to go to Dublin for that for 3 weeks. So, you know, if we had that multidisciplinary approach and that community access here in Cork, I don't think it would have gone that far. And even if it had gone that far, the needs could have been met here at home, where he would be with his family as well, where we would have been able to be with him and help him through it. And you know, I suppose we pushed for this ourselves. We certainly are luckier than some people in that we can seek some of this privately. That's not available to everybody, or it's not within their, you know, their capability to pay for it privately. Ivan also, he has support here at home. There are people living with, I mean, it's Parkinson's, but you know, other neurological conditions where they're living alone. And they can't always be alone because of the lack of supports in the community. And I think that's dreadfully, I'm going to say sad. You know, I like to say we're living, and it's we as a couple. I don't have it, but I still live with it. We're living with Parkinson's. And community neurorehabilitation centres would support us and others living with neurological conditions in our quest to live well for as long as possible, and in our homes, in our communities. And I guess, you know, thank you for attending today. Thank you to the panelists. Thank you to our audience. And we're asking for everyone to help us follow through and get the remaining 7 of these centres, you know, up and running nationally, rather than having just these 2 centres to cover a whole population. It is essential. I suppose I'm probably termed a carer by a lot of people. It's a word I hate using. I think for me, there are connotations of me caring for someone who is not capable of looking after themselves. And that's certainly not the case, but he does need some assistance. And I'm not a healthcare professional. I don't know how to handle Ivan if he falls. You know, we need access to things like this, to courses, to people who can show us what to do so that I don't injure myself, so I don't injure him. I guess, you know, we're at a different stage in life than some, particularly when it comes to Parkinson's. A lot of people view it as older people, and by no means do I want to sideline their needs or you know, throw them on the scrap heap, not at all. But we are at a different stage. I mean, we hadn't started a family when this all kicked off for us, so we've had that as well. And when you think of that, I like to say, you know, we're the same but different. So I was pregnant, and generally, you know, when you're in the later stages, you need a little bit of help yourself getting in and out of bed. But in our situation, it was I needed to give Ivan help to get in and out of bed. I wasn't trained to do that, you know. Luckily, we were fine with that. But I could have done injury to myself, to my unborn child, to Ivan. So we certainly need access to multidisciplinary teams where we live. And there's so many other things I guess we could talk about. There's the stigmas, you know, there's the fear for younger people who want to continue in employment of coming out and saying that they have conditions. You know, they want to stay working, but they need help to stay working. There is, you know, social welfare and having access to social workers who know the needs of people and who can help us navigate the system. We've been trying to do it on our own, and you know, Ivan has been completing application after application. You know, they take ages to go through and be reviewed, and then they get rejected saying, well, they've gone to the wrong place and you need to start again. So, you know, this is another thing I think could be supported in a community-based centre. There's like mental health for us, I guess, is a big thing. There are lots of different things that are big for people, different symptoms for, you know, experienced by different people with the same condition. And I do feel that, you know, access to a clinical neuropsychologist is essential. It's something that I really feel that people, when they're diagnosed with neurological conditions, they need to speak to someone pretty immediately, and their families do as well.
They need that expertise in the community. Thank you so much, Ivan and Eleanor. And as I say, we've seen today just the range, you know, as you say, the range of ages, the range of neurological conditions today. Thank you all so much for your testimonies, for your experiences, and for being willing to speak to them today. And again, I echo the call from all of our speakers. Just to echo Professor Ryan, this is not an add-on. This is something that people within CHO4 are entitled to. The teams are available in CHO1 up in the Northwest and in CHO3 in the Midwest. They are working so well on the ground in the areas where they do have teams, and they are providing such an essential service. And really, we can't have that postcode lottery where people in one part of Ireland living with a neurological condition get a completely different service to people in another area. So again, thank you all so much for speaking in support of the Patients Deserve Better campaign for community neurorehabilitation teams. I just mentioned in the chat there, we're going to be in Leinster House on the 9th of March, calling for this with that messaging to all of the TDs, that in the areas where there aren't current teams currently, these teams should be funded and they should be established. So thank you all so much, and our message is strong from CHO4 that this is a right for the people living in CHO4 to have a community neurorehabilitation team in place for people living with neurological conditions. Thank you everyone today. Thank you to all of our speakers. And to find out more about the campaign, just visit the campaign website, patientsdeservebetter.ie. One of the most important things that you can do on that website is just send, it's very, very simple. Pick your CHO, pick your county and send a message to your local TDs, because we really need political will and political commitment to deliver on these teams. Thank you all very much.